The debate that is going on right now is fundamental. And there's one candidate who is uniquely disqualified to make the case. It's the reason I'm here and he's not.
Tom is rubbing his head at the moment here because as a good Republican, he knows this can A, help the party's prospects, but B, is it shocking to anyone that in an election year, at the foot of the front steps of the Supreme Court, we got a candidate, Rick Santorum, of course, telling everybody why not only Obamacare ought to be repealed, but more importantly, that the Republican frontrunner is not equipped to weigh in on that. All right. It is a campaign season, of course, here. Republicans see this as a major vulnerability for not just the president, but Democrats. And what's interesting, though, is how the White House is approaching this. Because remember, how the White House let this play out and get to the Supreme Court, they could have let the clock run out and go through different appellate routes here. They let this thing go to the high court because they thought this was a fight worth fighting, and they wanted to do it in an election year. Now, after a lot of back and forth, the White House has embraced this as a campaign issue, and whether you call it Obamacare or whatever else you want to call it, they argue that Americans are going to back their efforts no matter what the Supreme Court says.
One thing I'm confident of is by the end of this decade, we're going to be very glad the Republicans termed this Obamacare, because when the reality of health care is in place, it's going to be nothing like the kind of fear-mongering that was done.
All right, that was David Plouffe over the weekend here, and you could basically turn on any of the Sunday shows, and you were hearing the same kind of argument. Now, I wanted to say, forget what the talking heads say, forget what the politicians have to say. What do the people say? Well, Kaiser does a poll pretty much every month here to get the pulse of you, the American public, and how you feel about this. Now, we're going to scroll some numbers up, but the key elements of health care reform as you go through it, from reform in the law for all here, the small business tax credits, the insurance subsidies, expanding Medicare, no denials, no cost preventative services, insurance ratio rebates. I can keep going up and down the line. The plurality of Americans, by pretty nice margins here, like it, except you get to the last one, the individual mandate. When it gets to that one, only 1 in 3 give it a thumbs up. The net consequences overall, for those who view it positively and negatively, it's a toss-up. It's about 41% either way, with about 18% undecided here. 19%, I lied. So the drill is the public doesn't know how they feel. You ask them one question, you'll get one answer. You get them a different question, you'll get another. And Dominic, I'm going to start with you. Is the White House smart here to say, heck yeah, let's talk about this thing here. Let's talk about how it changed lives for people. I've heard personal bios about women who all of a sudden could get a mammography, and as a consequence, it may have saved their life. Is this good politics, or are they playing with fire?
In my opinion, it's excellent politics. Tom may differ, and he may have a little bit of a valid argument, but let's keep in mind, but let's keep in mind, he ran on this issue. Meaning President Obama, then Senator Obama. Let's keep in mind we're talking about 30 million Americans that are uninsured. And so let's also put on the table that, in my opinion, they were very smart to get this before the Supreme Court now and ahead of the election. So no matter what happens, win or lose, and I think they're going to win, and they could, I think based on what the professor had said, they could even have a partial victory. They may lose the mandate, but still lose. I know you differed on that, but I think it was smart to do it now and do it so that even if they lose, they have a couple of months before the election.
You buy it, Tom?
No, I mean, quite frankly, is that because of Obamacare, he got crushed in the last midterm elections, crushed, and we have yet to see.
That's the number one reason everybody was voting?
That was a big reason. The economy was another reason, but that was a very, very big reason, the way that Obamacare was handled. And if it was such a good thing, Andrew, where are the ads on Obamacare? Why is the president, until this little week here where it's before the Supreme Court, he hasn't run around the country touting it?
On that part, I agree with you wholeheartedly. And that last poll shows you it's an education problem with the American people. They don't know what's in the bill. I think
isn't it his job to educate his constituents?
That he's
and why isn't he?
This.
Because the American people don't like it. That's a fact. If they liked it, I mean, they do internal polling all the time. If they like it, he'd be running around talking about it from Hawaii to Maine.
But when you go back to the individual tenets of it, that you can keep kids on your insurance until they're 26, the free, free preventative services, that sort of thing, can't be cut because of your pre-existing condition. People like that overwhelmingly. The numbers show that. People just don't associate that necessarily with healthcare reform overall. That's part of the education
You think that's
process
a good thing?
that the president has
Well,
to go
why don't
through.
we keep him
I
on
think
until
all
they're
of those
43?
I think all of those tenets are tremendously good.
You know,
things.
Professor, AMA came out in support of this thing, but I haven't seen. I would have expected politically that I would have seen a lot of guys in white coats here saying how this was the greatest thing since sliced bread, that this changed medicine for the better in America. And if you track the stories on this, it's more negative than positive about costs that are incurred by the medical industry, doctors being forced, employers being hurt. From a PR level, it certainly seems like they start a little late in the game. They've been playing defense to this point.
I find it surprising because it seems to me that you can make a powerful case against the insurance companies. You can make a case that the insurance companies, before this law, were allowed to cancel your insurance if you got really sick.
I'm with you. I would have thought the easiest sector to go after here was the HMOs.
The insurance
Who likes the
companies don't give you
HMOs?
insurance if you've got pre-existing condition. It seems to me that those two parts of the theory behind this bill were to stop the insurance companies from abusing people like that. And yet, I guess that just hasn't resonated with enough of the American
My stepson's
people.
a plastic surgeon down in Georgetown. He is a liberal Democrat. He hates this. He will not vote for.
See you guys at Thanksgiving.
Yeah, he hates this. He says the doctors that I work with every day, they may politically, some that hate it. And, you know, I think that what we really need to focus on is what you talk about, is that, you know, where's tort reform in this country? I mean, that's really hurting, you know, the medical, field here. We don't talk about all those things.
We're going to be hearing on NFL from a couple docs who feel strongly on both sides of this issue later this week.